Thank you for staying with us. It's Journalist Hangout on Sunday. There's no love lost affairs between the resident doctors in Nigeria and the government. Is showing no sign of remedy. Doctors under the aegis of National Association of Resident Doctors have reviewed their demand for salary increase from 200 to 550%. This, to them, is to cushion the negative impact of fuel subsidy removal. The doctor said the parameters used in arriving at the demand for a minimum of 200% increase in CONMESS has significantly changed following the removal of fuel subsidy and attendant rising costs of living. Jide, are we going to see a kind of ripple effect in all sectors? These are doctors now?
Actually, this matter had been there for a long time. Remember, they issued a warning strike, went on a 5-day warning strike, and 7 weeks after the warning strike, they are saying no attempt has been made to talk to them and address their demands. And the demands include payment of outstanding arrears owed members, including hazard allowance, keeping arrears of 2014 to 2016, arrears of consequential adjustments of the minimum wage, immediate payment of 2023 medical residency training fund as contained in the 2023 budget in line with various agreements reached. What they are saying right now is, look, we are extending this ultimatum by another 2 weeks. And if by July 9 nothing is done, then people should expect a strike over government's refusal to review upward the consolidated medical salary structure in line with the letter sent to the minister on July 7, 2022. So this is not exactly new. It's just the result of the former administration's inability to address the demands that had been there since even 2020. You know, they first complained in 2020. They had to fight over the issue of hazard allowance. Okay, government agreed to increase the hazard allowance. My own concern is why we get into negotiations with labor, and then when it's time for us to fulfill our side of the bargain, we start pussyfooting. Up till now, the issues that caused ASU to go on strike, they are still there. And now you've seen that even the IPPIS, that some people wanted to kill themselves over, that ASU must succumb to IPPIS. We have now seen, the evidence is in the open, that IPPIS itself is a fraud. We've seen that now. So, which means that these guys had a point when they said, no, don't subject us to IPPIS. The industrial court has ruled now that you cannot force ASU to be drawing their salary through the IPPIS. It infringes on their right. Whereas some people, including even some academics who are supporting government blindly, were saying, no, you can't tell your employer
how to pay you.
How to pay you. But if your employer comes up with a plan that even distorts the academic system, is the employer supposed to be left alone? Because we all know lecturers go on sabbatical and the rest, they go for research in other universities of the world. Some even come to Nigeria. But the IPPS does not capture such people. And there are lecturers today that I can tell you who had been on research in another university, and for 15 months now they have not been paid. These are issues that when people get up to say they are going on strike, you start abusing them. You will not talk about government because we have a history of simply addressing issues based on emotions. Solve the problem on ground. Solve the problem. We cannot afford another strike. By these guys, a good number of them have left the country already. If we create a situation in which doctors would always want to go on strike because their demands are not met, including demands that government agreed. Because I know this residency thing, I know the role that Gbajabiamila played. And part of what is the problem at that time was that Gbajabiamila proceeded to insert it into the budget. Now, what's inserted into the budget is not paid. And you will expect that they will keep quiet. When they go on strike now, we'll start abusing them. We'll start calling them names. Government has to change its ways. Don't get into negotiation with people and then
not honoring it.
And then say, okay, you are going to do this, you are going to do that, and then turn around to not honor your own side of the bargain. It's not right, it's immoral. Mr. President has not named his ministers, but we expect a minister that will be inversely different to the man that we had to live with for many years as minister, an adversarial labor minister who took joy in fighting labor. Hopefully, that's not the kind of person that the president will bring this time. He will find someone with fantastic negotiation skills who will be able to interface properly with labor, and all of these issues will be a thing of the past. But I don't want to see. I know when you talk about 55% salary increase over fuel subsidy, people usually start bargaining at a high level. At some point, they will find a middle ground. Everyone, even labor has said, give us 200,000
minimum wage.
We have some states can't pay 30,000. You know, I think it's
battling with 18,
TUC, not TUC. So we have to find a way to ensure that we have industrial harmony, to ensure that strikes are reduced to the barest minimum.
Wale, how do you address this issue raised by the resident doctors?
I think one thing we should all agree is that the health aspect is one of the most important sectors in the country because it affects almost everybody. A healthy nation is a productive nation. So we cannot joke with health because it's about life and death. They have raised this issue, 2-3 years. It's an ongoing challenge. And if you look at our situation, we have doctors that get probably about 290,000 on the average, general practitioners, between 292,000 to 300,000 per month, up to 1 million. People are neurosurgeons because they get the highest pay. Now, if you compare this with their counterparts in Canada, in UK, in elsewhere in Europe, you discover that the gap is high. The gap is high. So in Canada, for instance, they do get as much as 75,000 USD in 1 year. In UK, about 65,000, and then in US, maybe about 75,000 too. So compare with what our doctors get here. Maybe a neurosurgeon gets about 6 million naira in a year. So compare with the importance of what they do in relation to the health of the country. I think it's low. However, we also need to realize that if we don't pay them what they require, it's something reasonable, they will continue to leave our country. We understand about 5,000 doctors left in the past 5 years. Not only doctors are leaving, nurses, I think about 57,000
training them.
of them.
Training them.
Midwives, combined with nurses, about 75,000 have left. And I think there was a recent...
Pharmacists.
Even pharmacists. There was a recent survey
what they call it?
Yeah.
Laboratory
Laboratory technologists, you know. There was a recent survey that indicated that 85% of Nigerian doctors are anxious to leave the country.
Yes.
And if you look at the ratio of doctors to freshers, in fact, from final year, they're already looking up to, you know, leaving the country,
exams,
going to UK, going to even Ghana, you know, going to Saudi Arabia, UAE, and all that. And if you look at the average, you know, we have about one doctor to 10,000 people. In some countries, in some states in the north, average of one doctor to 45,000. So experts are saying that we still need about 363,000 doctors to meet up with our demand. We have only 24,000 now. Out of these 24,000, some are not even practicing. Some are into politics, some are into consultancy. So we don't have enough doctors. We must do everything possible to ensure that we keep them to stay in this country. However, given the reality of our economy, I think they are asking for 550% increase or thereabout. That will be about almost 2 million per one doctor. Are we in a position to pay that, given the reality of our economy? So I think the government should sit down with them, negotiate in a very honest, transparent, and decisive manner, and increase that salary within the scope of what the federal government can accommodate. I don't think 550 is realistic if you look at what is going on in the country. But I think we should negotiate.
A starting point.
Yes, a starting point, so that we can have a situation where these doctors will not continue to leave this country, you know, as they are doing at present.
The turnover is ridiculous.
It's worrisome. Yes, although
and it's easy for us to train them. We train, but
it's very cheap to train them here. It's very cheap, and that's why it's painful. And the doctors that we train here, yes, they are subjected to some examination even outside, but they still excel. They still
pass the conversion exam.
So we do not have enough medical colleges like the Indians, for example. The medical colleges that we have are not enough. Even when you combine private universities with public universities, they are not enough to meet demand. A good number of our doctors are in the tertiary medical centers. They are not in the
primary health centers.
Yes, because
we don't have them.
You have to incentivize
for
doctors staying in the rural area,
local governments.
A lot of what kills our people are preventable.
Access to this health care.
If there is access to Medicare, these things are preventable. Malaria that kills so many people is preventable. You know? So when you look at our country in terms of doctor to patient ratio, we are the worst. Yet we keep losing doctors. You can argue that the Indians too, that their doctors are migrating abroad. You know, Egypt, where a good number of rich Nigerians actually go to for Medicare. Their doctors too are refusing to stay, despite the fact that the Egyptians came up with a law mandating you to first, upon graduation, to first go and work in a public health institution for 3 years. It has not stopped them from leaving. So it's like the advanced countries of the world have descended on the third world countries. What is happening to us is happening to other third world countries. They want the best that you have. Look at a country like Canada, for example. Once you are a skilled laborer, they want you. They want you. Germany, the same thing. Because the workforce in Germany is aging. So they don't mind bringing people from the Arab world, bringing people from Nigeria and other places to come and work in their companies. And the economy is doing very well. It's the most advanced country in Europe. So we can't stop people from economic migration, but we can at least reduce the rate at which these people are living. And one of the ways by which we can do that is to pay them promptly. We still have a situation in which state universities are owing doctors They can't manage, they can't fund state universities, but they are setting up state universities. Now they are owing doctors. Up to 5 months salary, you are owing medical doctor. If you owe a medical doctor up to 5 months salary, are you not endangering the lives of patients? Because a medical doctor that is not in the right frame of mind, and you tell him to go and look after people, something is wrong with our leaders. You can't hold that category of workers. It makes no sense. It's part of the demands that they made that, look, in private, in state universities, our colleagues are being owed. Address the problem. It's part of their demands. So what has been done? If you leave workers' demands unattended to, then you are creating a fertile ground for industrial disharmony. And what is industrial disharmony? It's still strike at the end of the day. We don't want to see that strike happen. I hope that the new administration, although there are no ministers yet, at least at the level of PAMSEC, the ministries, they need to ensure that this strike that they are threatening us will happen from July 19 does not happen. Government has to be responsible. They've got to stop this strike from happening.
All right. For the embattled UTME candidates, Mesoma Ejikeme